Welcome on board. Today, I want you to walk through with me in the basic infection control of Al Quwain Hospital. We all work in a hospital setting where there is a higher risk of either spreading or contracting infectious diseases. Infection control is vital to your well-being and the well-being of the customers. You and your customers should know and take special precaution to prevent infections. The purpose of this training is to teach infection control and prevention to help you maintain optimal wellness, both for the patient you serve and yourself. In today's training, we have 5 objectives to tackle. I will introduce you to the infection control of Al Quwain Hospital. We will be refreshing our mind with a review of the chain of infection. We will also look into the standard precaution and transmission-based precaution. We'll have to describe how to put on and remove personal protective equipment or PPE. And lastly, how we manage staff health and safety risks. It is mandated by the Ministry of Health and Prevention from its policy on infection control education for staff, patient and family with code USO Clean 054 that all staff who join the hospital has to receive and be trained with infection control and are required to attend infection control orientation program. This is the mission of the hospital. That is to promote a healthy and a safe environment by preventing transmission of infectious agents among patients, staff, and visitors. And this is achieved through the concerted efforts by each and every staff in the hospital. For the services, we strive to provide a hospital-wide range of services through collaboration and coordination with different departments of the hospital. That is, in order to improve patient outcomes by preventing and controlling the spread of healthcare-associated infections. For our top 10 activities, we have the following. We provide and implement effective infection control program. We give education to staff regarding infection control principles and infectious diseases. We also establish a reliable focused surveillance program for healthcare-associated infections. Likewise, we collect and analyze healthcare-associated infection rates. We perform continuous improvement project in order to reduce healthcare-associated infection to the lowest possible level. Also, we do write and periodically review our infection control policies and procedures. We monitor staff compliance regarding policies and procedures, and we do a lot of auditing. We oversee infection-related issues relevant to employees' health. We maintain a comprehensive data recording. And lastly, we carry out outbreak investigation when an outbreak is identified. What are the importance of infection control? First, it improves patient safety via prevention, identification, and control of infections and communicable diseases. It prevents patients from acquiring infections while they are receiving treatment in the hospital. And infection control is important in order to control workplace hazards and eliminate or reduce staff exposure to occupational health risks and further staff management in case of exposure. How does infection spread? Understanding how infections become established and how they are transmitted is essential for effective infection prevention and control. Infections are the result of a consequence of events that takes place between an infectious agent a host, and an environment in a process that is referred to as the chain of infection. There are 6 links in the chain of infection. 1. The germ or pathogen. The first link in the chain of infection is the infectious agent or pathogen, which can take in the form of virus, bacteria, fungi, or parasitic prions. How well a pathogen is able to thrive and cause infection depends on 3 factors. That is, its ability to produce disease, its severity or harmfulness, and its tendency to enter the tissue and spread. Number 2 link, the reservoir. A reservoir is the principal habitat or place in which a pathogen lives, flourishes, and is able to multiply. Common reservoir for infectious agents includes humans, animals or insects, and even the environment. Number 3 link, the portal of exit. The portal of exit is any route which enables a pathogen to leave the reservoir or host. In humans, the key portal of exit are the following: vomitus, diarrhea, through coughing, sneezing, and talking. Number 4 link, the mode of transmission. There are 2 main ways that an infection can be transmitted from its reservoir to a susceptible host, either via direct transmission or indirect transmission. Direct transmission tends to be instantaneous and occurs when there is a direct contact with the infectious agent, while indirect transmission can occur through an animate mechanism such as fleas, ticks, flies, or mosquitoes, or via inanimate mechanism such as food, water, biological products, or surgical instruments. Indirect transmission can also be airborne, in which tiny particles of an infectious agent are carried by dust or droplet in the air and inhaled into the lungs. Number 5 link, the portal of entry. The portal of entry is the means by which pathogen is able to enter a susceptible host. Portals of entry into the human body include inhalation via the respiratory tract, absorption via mucous membranes such as the eyes, ingestion via the gastrointestinal tract, inoculation as a result of an inoculation injury, introduction via the insertion of a mechanical device. Number 6 link, the susceptible host. The last link in the chain of infection is the susceptible host. It is a person who is at risk for developing an infection from a disease. How susceptible any host will be depends on a variety of factors. Their age, in particular, if they are very young or very old, whether there is any presence of malnutrition or dehydration, any underlying chronic diseases, if the host suffers from immobility, if they are taking any medication which could disrupt or suppress their immune response. All this makes the host susceptible to infection. Note that all 6 links need to be connected in order for a disease to be transmitted. Any of the link or even one link is broken, an infection will not occur. So let's break the chain of infection. The challenge is, how can we break the chain? Remember that breaking the chain of infection is the responsibility of each and every employee working in the hospital. There are opportunities to break or disrupt the chain at any link. One is called Standard Precautions. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. These practices are designed to both protect and prevent the staff from spreading infections among patients, staff, and visitors. Standard precaution includes the following: hand hygiene, use of personal protective equipment, sharp safety, environmental cleaning, cleaning and reprocessing of shared patient equipments, respiratory hygiene or cough etiquette, aseptic technique, waste disposal, and handling and disposal of waste and linens. Let us look closer into each of the elements in the next slide. Number 1, hand hygiene. Hands are the main pathways of germs transmission during healthcare, accounting to about 80% as per CDC. Hand hygiene, therefore, is considered an important practice in reducing the transmission of infectious agents that cause healthcare-associated infections. It is a simple yet inexpensive way to stay healthy. Hand hygiene is an expectation and not an option. There are two types of hand hygiene. Hand hygiene consists of washing the hands with soap and water or use an antiseptic hand sanitizers. Hand washing is performed by using soap and water when hands are visibly dirty or visibly soiled with blood or other body fluids, or after using the toilet. While hand rubbing is cleaning your hands by rubbing them with an alcohol-based formulation. This is the preferred means for routine hygienic hand antisepsis if hands are not visibly soiled. Performing hand rubbing is faster, more effective, and better tolerated by your hands than washing with soap and water. If exposure to potential spore-forming pathogens is strongly suspected or proven, including outbreaks of Clostridium difficile, then hand washing with soap and water is the preferred means. When to perform hand hygiene? Generally, any person involved in direct or indirect patient care needs to be concerned about hand hygiene and should be able to perform it correctly and at the right time. That is, immediately upon arrival at work, before direct contact with patients, before putting on the PPE, before touching the face, the eyes, before taking food, and before leaving for work. Also, hand hygiene is performed in between procedures on the same patient, after contact with the patient, after removal of PPE, after contact with body secretions, after contact with contaminated surfaces, and after personal body. Specifically, the 5 moments of hand hygiene approach was designed by the WHO in order to minimize the risk of transmission of microorganisms between a healthcare worker, the patient, and the environment. The moments include before touching the patient, before a procedure, after a procedure or body fluid exposure risk, after touching a patient, and after touching a patient's surroundings. In 2008, the WHO designed a hand-washing leaflet making reference to Taylor, who indicated that the fingertips, interdigital areas, thumb, and wrist are the most commonly missed areas in hand washing. In order to wash all the sides and parts of the hand, we follow the hand washing steps as recommended by the WHO. They are straightforward and effective for thorough cleaning. The recommended hand washing time is about 30 to 60 seconds, so make sure you complete all the steps and don't rush through them. Clean your hands by rubbing them with alcohol-based hand formulation. This is the preferred means for routine hygienic hand antisepsis if hands are not visibly soiled. It is faster, more effective, and better tolerated by your hands than washing it with soap and water. Apply about 3 to 5 ml in your palm. Rub vigorously, making sure to rub the products all over the surfaces of both your hands and between your fingers. Rub for about 20 to 30 seconds until your hands are completely dry. Wearing gloves does not replace the need for hand hygiene. Hand hygiene should be performed before putting and removing gloves. Gloves should be removed to perform hand hygiene during the care for a single patient as indicated. Single-use gloves should not be washed but discarded immediately after use. Standard Precaution 2. Personal Protective Equipment or PPE. What are PPE? PPE are various barriers or garments placed to protect the user against health or safety risks at work. Why we have to use the PPE? This is to protect a susceptible patient from inadvertent colonization and subsequent development of healthcare-associated infections. When do you use PPE? Use PPE as part of the standard precautions and transmission-based precautions depending on anticipated exposure. And who has to use the PPE? So all healthcare providers are expected to wear PPE. The PPE consists of gloves, mask, gown. If it is blood or airborne infections, it will include face protection, goggle, mask or face shield, gown, coverall, head cover, and shoe cover. Standard precaution number 3, respiratory hygiene or cough etiquette. Cough etiquette are infection prevention measures designed to limit the transmission of respiratory pathogens spread by droplet or airborne routes. This is how to do. Sneeze or blow your nose or cough into a disposable tissue and discard into a bin and wash hand immediately. If tissue are not available, cough or sneeze into your upper arm sleeve. Avoid using your hands. Turn away from people when coughing or sneezing. Standard precaution 4, waste management. In order to minimize the potential spread of diseases from the hospital waste to the general public, all waste, including clinical and non-clinical waste, should be segregated, collected, transported, and disposed safely and appropriately in order to avoid the risk of injury or harm to healthcare workers and all other staff, including the general public, as well as to protect the environment. All staff follow the local regulation on healthcare waste disposal, including that of the municipality and the UAQH waste management. There are different types of waste in the hospital. One is called highly infectious waste. Highly infectious waste are waste that are considered contaminated with contagious pathogens. For example, waste coming from the isolation wards, research laboratories, tissues, equipments that has been in contact with infected patients. All these waste are disposed in the red bin. The second is called infectious waste. These are all waste that come in contact with human blood or fluid considered as infectious waste. For example, pathological waste, anatomical waste, human tissues, used gloves, aprons, masks, shoe and head cover, dressings, bandages, cotton balls, peripods, diapers, cotton swabs, All these waste are disposed in the yellow bin. The third type is called sharp waste. Sharp waste are those which includes needle sets, scalpels, knives, blades, broken glass. These types of waste are disposed in the sharp bin. We also have what we call as chemical or pharmaceutical waste. These are waste in small quantities coming from chemicals and laboratory reagents. Likewise, it includes pharmaceutical waste that are expired or no longer needed except cytotoxic waste. Another type is called radioactive waste. These wastes are returned to the supplier. And the last type of waste is called municipality waste. An example of municipality waste are aerosols, domestic waste, food waste, paper towels for hand washing, paper packaging, materials used to clean up decontaminated or non-hazardous spills. All these type of waste are disposed in the black bins. Standard Precaution 5. Cleaning and disinfecting of equipment. All reusable instruments, devices, and equipment will be decontaminated, disinfected, or sterilized prior to use on a patient. Follow the disinfection cycle from cleaning, rinsing, drying, disinfection, rinsing after disinfection, drying, and storage. It is also important to follow the manufacturer's instruction for cleaning and disinfecting the device. Precaution 6. Environmental cleaning. Keeping hospital clean is a crucial patient safety issue. The importance of hospital environment in patient care has only been recognized widely in infection prevention and control. The environment should be kept dry, clean, and well ventilated, and ideally exposed to sunlight to prevent microbial multiplication and the spread of multi-drug resistant pathogens. Patient areas should be cleaned regularly, especially high-touch surfaces such as beds, mattresses, infusion pumps, bed railings, touchscreens, keyboards, and medical equipments. Disinfection with an appropriate product could be considered in exceptional circumstances such as isolation wards. Terminal cleaning after a patient is colonized or infected with a multi-drug resistant bacteria leaves a room should be first cleaned thoroughly and then disinfected with an appropriate disinfectant. Are standard precaution enough? It's not enough because we use transmission-based precaution in addition to standard precautions. Transmission-based precautions are designed for the care of patients known or suspected to be infected by epidemiologically important pathogens spread by airborne, droplet, or contact transmission. There are three different types of transmission-based precaution. Number 1, contact precaution. Contact precautions are used for infections, diseases, or germs that are spread by touching the patient or items in the patient's room. Any patient who has MRSA, for example, or diarrhea or open wounds, a staff who enters the patient room must wear gloves and gown. Other PPE may be worn accordingly. The second is called droplet precaution. Droplet precaution are used for diseases or germs that are spread in tiny droplet caused by coughing or sneezing. For example, patient may be having pneumonia, influenza, or bacterial meningitis. So any staff who enters the patient room must wear a surgical mask. Other PPE may also be worn accordingly. And the third is called Airborne precaution. Airborne precaution are used for diseases or very small germs that are spread through air from one person to another. For example, a patient may be having either tuberculosis, measles, or chickenpox. So, a staff who enters the patient room must wear an N95 respirator, and other PPE may be worn accordingly. In staff health, we strongly emphasize the importance of personal hygiene, adherence to standard and additional precaution, and avoiding penetrating injury and exposure to blood-borne pathogens. For pre-employment screening, all prospective employees should undergo screening for hepatitis B, C, HIV, MRSA, and COVID-19 prior to the commencement of duty to determine their ability to work in a safe manner. Every staff have the responsibility to ensure his or her immunization status is current and appropriate. We provide hepatitis B vaccine, flu vaccines, and meningitis vaccines. In case of accidental exposure to blood-borne pathogen or an injury happens at work, then the following procedure has to be followed. The administration of first aid action will depend on the nature of the exposure and the type of body fluid, but as a rule, the following action should be taken. For a needle stick injury, encourage free bleeding of any wound but do not suck the wound. The wound should be washed under copious amounts of warm running water for at least 2 minutes. The wound should not be scrubbed. If necessary, cover with a waterproof dressing. For mucocutaneous exposure to mucous membrane, conjunctiva, or non-intact skin, wash the exposed site immediately for 10 minutes with a copious amount of warm water or a normal saline in the case of conjunctival contamination. Report the accident to the relevant person and to the Infection Control Department and complete an incident report. How to manage exposure to potential blood-borne pathogens. The exposed employee has to obtain first aid immediately. He or she has to report to her supervisor, attend OPD clinic during working hours, or in A&E department after working hours and on weekends. Determine hepatitis B, C, titer, and HIV. Comply with treatment and follow-up care. And lastly, complete OVR and accidental inoculation report form. The culture of safety is the shared commitment of management and the employees to ensure the safety of all care providers and patients in the facility. Together, we can make it work.